The International Inn is closed again by the Board of Health. We have details on this episode of Barnstable Today. It's Thursday, August 20th, 2015. I'm Sarah Mannel. The Board of Health closes the International Inn again this week after health inspectors found critical health code violations. The International Inn faced a hearing on those violations during this week's Board of Health meeting. Health Division Director Tom McKean talked about the most recent violations during the hearing.
This hearing is a continuance from a previous hearing, but due to critical and non-critical violations on August 26, 2014, February 12, 2015, and July 16, 2015. After the July 16th, the board had asked for more inspections. Inspections were conducted on August 3rd, August 5th, and August 12th. Again, I want to say there was another failure. The August 12th inspection showed 8 critical violations. This makes the 6th inspection that failed in the past 2.5 years. So a total of 16 inspections were conducted at this establishment in 2.5 years, and there has been 6 failed inspections during that time period. If you want to go through each inspection, we can.
No.
The problem seems to be a recurring theme is in regards to ServSafe certification employees or lack of employees that are ServSafe certified, and refrigeration problems, sanitation problems as far as keeping wiping cloths in the sanitizer container not being done, holding temperatures for potentially hazardous foods such as bacon and other foods at improper temperatures.
International Inn owner Bon Bonta told the Board of Health that staff changes were largely to blame for the health code violations.
And in the last year or so, we kept getting people, and no matter what we tried, one way or another, all what you see here is violations done by the employees. Whatever asked for us to do, we have done it. And now we brought the person who was there before when there were very few violations compared to what we had in last year or so, and hopefully things will be much smoother. Whatever list was given, we requested the health inspector to come by. She has been there twice, including this afternoon, and she saw the progress. We have brought the person who is doing all the fixings, whatever have been asked of us, and he's here, the contractor who has done most of the work. And we went through the list point by point, and if we miss something, tell us and we will follow it. I mean, we have employees, cases like a ServSafe. We hire a person, and I don't want to say how much we are paying, much more than anybody. He comes, starts the kitchen, and he leaves with the ServSafe certificates, and then we have nobody. It's like 7 in the morning. And we wouldn't even know. We come, by the time we come, you know, people were there, and there was one girl we have hired as a backup. And she said, close, and we close. We always follow whatever is asked of us. But the employees are so difficult to get, and now we have 1, 2, 3 ServSafe people at the premises.
Board of Health Chair Dr. Wayne Miller expressed frustrations with the number of repeat violations and began the discussion of possible operating conditions for the International Inn moving forward.
You know, whatever. The reality is that the number of critical violations, the need to close this facility down repeatedly in the last year and a half,
Two and a half years.
2.5 years, makes me feel that we've got to find a way, if we're going to allow you to continue to operate, we're going to have to find a way to make sure that the public health is protected. Don, what are your recommendations in terms of conditions?
Prior to any reopening, I recommend that each food handler go through ServSafe training, certification, and that the owner of the food facility hire a consultant that would advise them on a regular basis to stay in compliance with the state and federal food codes. Those are my two recommendations.
Donna, anything to add to that?
Well, they currently do right now have 3 serve-safe people on site. And they've fixed the refrigeration problems. And they've got a pest person on board, a pest company, because it's been cited for the past 2.5 years, chronic problems with fruit flies. So they're addressing that, and right now they're resolved, but it's 16 inspections over the past 2.5 years has taken up a lot of our time.
Board of Health member Dr. Paul Caniff recommended that the board close the International Inn for a period of time long enough to correct operating practices at the establishment.
And I would feel that there should be a suspension of the license, maybe for 30 days, and to give you people a chance to hire a specialist like Mr. McKean suggested, and to come up with a plan and rectify your problems. And then in 30 days, apply for another inspection to see if things can go forward. I don't see any, this history is absurd. The public health, people eating in there, that's ridiculous. I don't think this, the operation of this restaurant is fit to continue.
If you're considering a suspension, is there the option to possibly postpone the suspension until either Labor Day or the end of the season, as they have their rooms are rented or will be rented out?
What are you going to do with the health of the people? I understand what you're saying, but I think, we're just getting people that are, it seems like they're, maybe people are don't understand what the problem is. The problem is the health of the individuals that are in there.
If they hire a consultant and only have the kitchen.
I think that's my opinion. I think there should be a suspension, and I think there should be a stipulation that you hire a consultant and to get the things in order. To me, this is...
Dr. Mill, that was going to be the second part of my recommendation as well, a 30-day suspension.
Board of Health Chair Dr. Wayne Miller and Dr. Paul Caniff discussed the length of the recommended closure.
I guess the request I have is both of Tom and Dr. Caniff, and that can I have a rationale behind the 30 days versus 60 days or 90 days or permanent. I'll go that direction rather than the lesser. Is there? I'm being totally just open about it. Why the 30 days? Because I think that's the number that we are going to have to justify. I have no problem with it. I think that there needs to be a suspension here, but I need to know the rationale for 30.
I think the 30 days is enough time for them to hire somebody, to get a plan, to straighten out their problems and come back. I don't think they can do it in 2 days or 5 days or 10 days or 20 days. I think 30 days is time frame that they need to do everything. We've got history, so we know what we're dealing with. We need to get something done that's going to work,
and
for their sake.
And permanent. Not something we got to deal with.
Definitely.
No, that's what I'm asking. I need a rationale behind the 30, and I think that's a perfect rationale, that these problems are such and they've been so long-standing that I don't want to. I agree. I don't want to reopen them with Band-Aids.
After much discussion, the board voted to close the International Inn for a period of 30 days. The owner will also be required to hire a specialist to help straighten out any problems. Well, be sure to tune in to our hour-long news program, Barnstable This Morning, weekdays at 7 a.m. On tomorrow's show, we will have our weekly arts and culture segment. We'll take you inside the Recreation Division's annual talent show. Plus, we have all the news and information you need. For Barnstable Today, I'm Sarah Mannel.